Hello, my name is Margaret in Ortega. I'm an occupational therapist. I became homeless in September 22nd, 1991.
My name is Denise Jones. 3 years ago, I was homeless. I lost my job. I stayed in a drop-in center for about 2.5 years.
Hello, my name is Youssry Ghandour. I'm from Fort Washington. My depression started about 10 years ago. Then when I felt that I'm not going nowhere, losing my job, especially after I lost my business at that time.
My name is David Broxton, and I'm here today to tell you my story. I know that in the Big Apple there's 8 million stories. Mine is just one of them.
Yes.
I was not able really to pay it and got
So
my
you had
credit bad.
bankrupt.
But you have Medicaid now, right?
Yeah.
I have Medicaid.
Yeah.
See, that's a blessing. I didn't have Medicaid at first, and then when they gave me the ticket to ride. You understand?
My situation was I used to hemorrhage. And I had fibroid tumors in the uterus and also in the fallopian tubes. That's a girl thing. And I was hemorrhaging. So to bleed more, and every month I bled for the whole month, sometimes even longer. And I was turning like a ghost. Couldn't get up and just clots were coming out of my body.
I felt something strange is going on, which you call it hearing voices as mental disorder. And until everything was against me, I found myself losing my job. I did not realize where I'm going to. I did not think that I can survive in any job because I did quit so many jobs until I left the whole state I used to live in, which was North Carolina, and I decided to come to New York. And I did not know where I go, and I was being in shelter was not in my mind, and I never thought about shelter could be in New York.
I had this feeling that I really didn't care no more, you know. And I took to the street, and I took to drink and drugs and things. I wound up going to a shelter. While I was there, you had to get a physical. She said to me, you have to do blood work and so on. And she did blood work on me and found that I had cancer. And man, the reality became a nightmare. Listen, I'm not afraid to talk about being homeless. Mm-hmm. The thing is that I made it back.
Thank God, and you survived it.
That was so magnificent.
They have a doctor on board and 2 assistants and a nurse is always there. I went to see a specialist, and they told me you got fibroid cysts. I have fibrocystic disease. And I said, wow, I didn't understand what it meant, but they were really polluting my body. So anyway, and there they also send you, if you needed a psychologist, they send you to a psychologist, private. Anything you needed, you just let them know.
I went for women's health. I had my mammogram and my GYN, everything, came out well. They had a person who came around who spoke on women's health, which was a great encouragement to myself and the other clients at the shelter. My experience is that the medical part is excellent.
I was amazed, really. I never thought that shelter can have such comprehensive medical health care, dental, psychiatry. It's amazing.
And she looked at me with such sincerity, and I had many doctors in my life, but no doctor ever took a personal, there's 90 people that live in that place, and she took me like I was her brother or somebody, a relative, and talked to me.
I give them an A+, and I figure every shelter that anybody goes into, they need somebody to social worker, and also if they need any kind of health assistance or whatever, that should be provided for them.
There were clients there who haven't been for physicals and whatnot, and they found out that they had certain things, and if it wasn't for the shelter physicians, they wouldn't have been able to treat their, whatever was ill.
Shed now much better than I can say 1 year ago, and I'm very grateful really that the administration had such help available, which I never knew about.
Hey, I'm grateful that I was the one that met their medical team and helped me out the way they did. You understand? Because they saved my life,
Being as I was homeless, on behalf of the homeless people, I just want to thank the providers for their, for their sincerity towards us, and thank you.
Thank you very much.